Knowing what gout patients should eat is a critical component of long-term disease management. Diet plays a significant role in the treatment and prevention of gout flare-ups. So, what foods are beneficial for gout patients, and which ones are recommended by nutrition experts? What is gout? Gout is a metabolic disorder characterized by elevated uric acid levels in the blood, leading to the deposition of monosodium urate crystals in joints. This results in swelling, inflammation, and episodes of chronic joint pain. Is gout dangerous? Gout is not inherently dangerous and can be effectively treated if detected early and managed correctly. However, it can lead to severe complications if left untreated or improperly managed. Gout is a common musculoskeletal condition, classified as a type of arthritis caused by an accumulation of excess uric acid in the blood. Elevated uric acid levels can result from various factors, including genetics, high protein intake, obesity, and excessive alcohol consumption. Due to these factors, gout is more prevalent in men than in women. The excess uric acid accumulates in the body, particularly in the joints, leading to swelling, pain, and inflammation, hallmark symptoms of gout. This condition can significantly disrupt daily life, limiting mobility and causing considerable physical and mental discomfort. Nevertheless, gout is generally a benign disease. In its acute stage, it can often be completely resolved with appropriate medication and a suitable diet. Potential complications of gout. Complications are more likely to occur in patients with chronic gout, the elderly with comorbidities, those with weakened immune systems, or individuals who fail to adhere to prescribed treatment regimens. Poor habits, such as a lack of treatment or lifestyle adjustments, can worsen the condition. Although gout itself is not life-threatening, its complications, such as fractures, kidney stones, or diabetes, can lead to lifelong disability and pose a significant risk to the patient's life. Can untreated gout lead to death? While gout does not directly cause death, neglecting its treatment can lead to increased risks of complications, which may indirectly threaten life. Prolonged gout, without proper medication or lifestyle changes, results in persistent pain from inflammation and swelling, potentially worsening over time. According to the Arthritis Foundation, uric acid can damage blood vessels, significantly increasing the risk of cardiovascular problems, including heart failure, heart attack, and stroke. Gout also raises the likelihood of kidney disease by 78% and doubles the risk of sleep apnea. It is strongly advised to seek treatment immediately upon diagnosis. While gout itself is not fatal, delaying or avoiding treatment can expose patients to severe complications that pose significant health risks. Factors that worsen gout. Gout becomes more severe when uric acid levels remain elevated for extended periods, increasing the likelihood of complications. A failure to follow prescribed treatments or reduce uric acid levels can exacerbate gout. This may result from late diagnosis, neglect of treatment, or noncompliance with medical advice. Nutrition plays a crucial role in managing gout. Even with medication, consuming excessive protein or alcohol can worsen the condition. 10 common complications of gout.
1. Tophi formation.
Tophi are urate crystal deposits that form around joints, common in individuals with long-term gout. These nodules appear as swollen lumps beneath the skin and are typically found on the feet, knees, wrists, fingers, or Achilles tendons. They are visible to the naked eye and can be felt upon touch. The surrounding area may feel warm, tender, and swollen, causing limited joint mobility and inconvenience in daily activities. 2. Joint damage and deformity. Chronic gout can lead to joint damage and deformities due to repeated inflammation. Persistent joint swelling may result in permanent damage, stiffness, and deformity, significantly impacting mobility. In severe cases, surgical intervention may be required to correct deformities. 3. Kidney stones. Excess uric acid in the body can lead to kidney stones, with about 20% of gout patients experiencing this complication. The kidneys filter waste, including uric acid, but prolonged high levels of uric acid can cause urate crystals to precipitate, forming kidney stones. 4. Kidney disease and failure. Kidney damage or failure can result from untreated uric acid kidney stones. These stones can harm kidney tissue, reduce kidney function, and increase the risk of chronic kidney disease or kidney failure. 5. Bone fractures. Gout increases the risk of fractures by weakening bone structure. Inflammatory damage from uric acid deposits and tophi formation erodes bones, leading to osteoporosis and higher fracture risks. 6. Eye problems. Although rare, gout can cause eye complications. Uric acid crystals may affect the eyelids, cornea, or iris, potentially impairing vision. 7. Cardiovascular diseases. Cardiovascular issues are a significant concern for gout patients. Studies show that gout doubles the risk of heart attacks and strokes due to uric acid-related blood clots. These conditions can lead to heart failure, significantly increasing mortality risks. 8. Sleep disturbances. Gout-related pain, often more severe at night, can disrupt sleep. Chronic sleep deprivation caused by persistent pain may lead to fatigue, stress, and other health problems like anxiety and depression. Common sleep-related issues in gout patients include insomnia, daytime sleepiness, and even sleep apnea. 9. Reduced bone density. Inflammation and tophi damage associated with gout can decrease bone density, increasing the risk of osteoporosis and fractures. Bone density is an important indicator of bone health and helps predict potential bone-related issues. 10. Mental health issues. Mental health problems in gout patients often stem from chronic pain, sleep disturbances, mobility limitations, and anxiety about the disease's progression. These factors can lead to depression, anxiety disorders, and reduced overall quality of life. Methods to reduce gout complications. To manage gout and minimize complications, patients should follow these recommendations. Limit foods high in purines and avoid alcohol, sugary drinks, and processed juices to reduce uric acid buildup. Stay hydrated to help flush excess uric acid from the body. Maintain a healthy weight. Exercise regularly to improve overall health. Monitor blood pressure, blood sugar, and other health markers. Schedule regular kidney function and bone density checks. Key precautions for managing gout. The most critical step is maintaining a balanced diet rich in vitamins and minerals while avoiding excessive protein and alcohol intake. Patients should adhere to prescribed medications, including anti-inflammatory and pain relief drugs, as directed by their doctors. To prevent recurrence, individuals with a history of gout should adopt a long-term healthy lifestyle, including regular monitoring of uric acid levels, kidney function, and bone health. These measures will help manage the condition effectively and prevent severe complications. How can diet help manage gout? Purines are organic compounds naturally produced in the body but also obtained from external sources, such as food. Adjusting the diet can help manage gout by reducing dietary purine intake, thereby lowering blood uric acid levels. Additionally, incorporating anti-inflammatory nutrients can help alleviate pain. Gout is a chronic condition, meaning it persists lifelong and cannot be completely cured. It often manifests as sudden, severe joint pain, particularly in the toes or fingers, significantly impacting the quality of life. Therefore, adopting dietary adjustments to minimize the frequency and severity of gout attacks is an essential part of disease management. Note, dietary changes are not a cure for gout. They serve to reduce the risk of recurrent joint pain and slow joint damage progression. What to avoid to effectively manage gout pain? What should gout patients eat? To effectively manage gout through diet, it is crucial to consume anti-inflammatory foods rich in vitamins and antioxidants. At the same time, limit foods that may increase blood uric acid levels or trigger inflammation, such as sugary or protein-rich foods. 1. Low purine foods. Uric acid is produced when the body breaks down purines, a compound found naturally in the body and in many foods, such as grains, alcohol, bacon, turkey, veal, venison, seafood, and organ meats. Gout patients should eat foods low in purines to prevent elevated uric acid levels and joint inflammation. Examples of low purine foods include eggs, nuts, low-fat dairy, purified whey protein, and most fruits and vegetables. Note, studies have shown that consuming purine-rich vegetables like spinach, asparagus, broccoli, mushrooms, and beans does not significantly increase the risk of gout or the frequency of gout flare-ups. Therefore, patients do not need to overly restrict plant-based foods high in purines. 2. Low fructose foods. Fructose, a natural sugar found in many fruits and sweetened processed foods, e.g., soft drinks, juices, desserts, can contribute to increased uric acid production during its metabolism in the liver. Research indicates that consuming fructose can cause serum uric acid levels to quadruple within 30 minutes, from 1 to 4 milligrams per dl, increasing the likelihood of gout flare-ups in the toes or fingers. Hence, gout patients should prioritize foods with low fructose content. Examples of safe fruits include oranges, lemons, grapefruits, pineapples, grapes, strawberries, blueberries, raspberries, and cherries. By carefully selecting the right foods and avoiding harmful ones, gout patients can better manage their symptoms and improve their overall quality of life. 3. GI, or glycemic index, is a measure of how quickly a food raises blood glucose levels within 2 hours after consumption compared to a reference food, typically glucose or white bread. Low GI foods are those that cause a slower rise in blood sugar levels after eating. Gout patients are advised to consume low GI foods for 2 key reasons: inflammation suppression and diabetes prevention. Inflammation suppression. A sudden spike in blood sugar activates the immune system. Inflammatory molecules, such as white blood cells and cytokines, are triggered to metabolize the excess glucose. This immune response can lead to systemic inflammation, exacerbating arthritis symptoms caused by gout. Diabetes prevention. Studies indicate that gout patients have a 36% higher risk of developing diabetes compared to the general population. Prioritizing low GI foods to maintain stable blood sugar levels can reduce this risk and contribute to overall health management. Examples of low GI foods: most vegetables, beans, nuts, and whole grains, brown rice, oats, wheat, buckwheat, and their related products. 4. Vitamin C-rich foods for gout management. Vitamin C-rich foods can benefit gout patients through 2 main mechanisms: reducing blood uric acid levels. Vitamin C stimulates the kidneys to excrete more uric acid through urine, effectively lowering blood uric acid levels and reducing the frequency of gout flare-ups. Reducing inflammation. Thanks to its potent antioxidant properties, vitamin C protects cells from damage caused by free radicals. Minimizing oxidative stress can help reduce inflammation, a key factor that worsens gout symptoms. Gout patients are encouraged to include vitamin C-rich foods in their diet to improve their condition. Examples of such foods include oranges, lemons, grapefruits, tangerines, strawberries, kiwis, guavas, spinach, broccoli, bell peppers, tomatoes, and potatoes. Below is a list of 20 safe and beneficial foods for gout patients, as recommended by experts at the Nutrihome Nutrition Center. 1. Low-fat yogurt. Studies show that dairy products, such as yogurt and cheese, can help lower blood uric acid levels. Compounds like orotic acid in milk may reduce the absorption and reabsorption of uric acid, promoting its excretion through urine and thus preventing gout flare-ups.
2. Citrus fruits.
Citrus fruits are rich in vitamin C, which can help regulate blood uric acid levels and alleviate gout symptoms. Examples include oranges, lemons, grapefruits, and tangerines. 3. Cherries. Cherries are packed with anthocyanins, powerful antioxidants that regulate uric acid levels. Consuming 10 cherries daily can reduce the frequency of gout flare-ups by up to 35%. 4. Legumes. Legumes, such as soybeans, lentils, and white beans, are excellent sources of protein with lower purine levels compared to meat. They provide essential protein for gout patients without worsening the condition. However, intake should be limited to 30 g/day to avoid excessive purine consumption. 5. Adequate water intake. Water helps lubricate joints, reduce uric acid deposits, and promote kidney function to excrete uric acid. Gout patients should drink 1.5 to 2.0 liters of water daily to manage their condition effectively. 6. Coffee. Coffee can lower uric acid levels by enhancing its excretion and inhibiting the enzyme xanthine oxidase, which is involved in purine metabolism. Moderate coffee consumption can help control gout symptoms. 7. Avocados. Rich in omega-3 fatty acids, Avocados help reduce the frequency of gout flare-ups and improve overall quality of life for patients. Enjoy avocados in smoothies, salads, or as a dessert ingredient. 8. Salmon. Salmon provides omega-3 fatty acids that combat inflammation. While it may slightly raise uric acid levels, consuming it in moderation, 2 to 3 times a week, can offer health benefits. Consult a doctor to determine a safe amount. 9. Olive oil and virgin plant oils. Olive oil, like avocados and salmon, is rich in omega-3 fatty acids that reduce inflammation and alleviate joint pain. Use olive oil in salads or cooking to replace unhealthy oils or animal fats. 10. Leafy green vegetables. Leafy greens are abundant in antioxidants like vitamins C, E, and K, as well as carotenoids and flavonoids, which reduce inflammation and protect cells from free radical damage. Their high fiber content also supports weight management, crucial for gout patients. 11. Berries. Berries such as strawberries, blueberries, raspberries, grapes, apricots, and cherries are excellent for gout patients due to their low fructose content compared to other fruits. They also contain antioxidants like flavonoids, particularly anthocyanins, which have strong anti-inflammatory properties to reduce swelling and joint pain. 12. Green tea. Green tea is a must-have for gout patients. It is rich in antioxidants, especially catechins like epigallocatechin gallate, EGCG. EGCG has potent anti-inflammatory effects, helping to reduce joint inflammation and pain associated with gout. 13. Broccoli. Broccoli is highly recommended for gout patients due to its low purine content, only about 70 milligrams per 100 g. Foods are considered risky for gout if they contain more than 300 milligrams of purines. Additionally, broccoli is rich in vitamin C, which helps regulate uric acid levels. 14. Whole grains. Although whole grains such as oats, wheat, brown rice, and barley have a relatively high purine content, their health benefits outweigh the risks. Their high fiber content helps regulate blood sugar, which in turn lowers uric acid levels, preventing gout flare-ups while reducing the risks of cardiovascular diseases, diabetes, and obesity. 15. Garlic. Garlic contains S-allylcysteine, which inhibits xanthine oxidase, the enzyme that converts purines into uric acid, effectively lowering uric acid levels. Garlic may also help reduce purine levels in high-purine foods like fish. Use garlic in cooking or as a marinade to minimize purines in meals. 16. Apples. Apples are low in purines and high in antioxidants like quercetin and vitamin C. Quercetin reduces inflammation, while vitamin C promotes the excretion of uric acid through the kidneys, making apples a beneficial choice for gout patients. 17. Bananas. Like apples, bananas are low in purines and rich in vitamin C. They are also high in potassium, a mineral that helps maintain the body's water and electrolyte balance, improving kidney function for effective uric acid removal. 18. Pineapple. Pineapples contain bromelain, an enzyme with powerful anti-inflammatory and pain-relieving properties. Bromelain can help reduce acute arthritis pain, making pineapples a helpful addition to a gout-friendly diet. 19. Eggs. Eggs are a safe protein source for gout patients due to their low purine content and abundance of antioxidants. Research shows that moderate egg consumption does not increase the risk of acute gout flare-ups, making them an excellent dietary choice. 20. Skinless chicken. Skinless chicken provides complete protein, including all 9 essential amino acids, and is rich in selenium, which boosts immunity and reduces inflammation. However, chicken is moderately high in purines, so it should be consumed in moderation. Portion guidelines. According to the University of Pittsburgh Medical Center, gout patients can consume up to 177 g of chicken per day, with individual servings not exceeding 85 g. Drinking about 200 milliliters of water before and after eating chicken can help flush out uric acid effectively. Caution. If your gout symptoms worsen, temporarily remove chicken from your diet until flare-ups subside. Proper lifestyle habits and a balanced diet are critical in managing gout and preventing complications. These measures, combined with medical treatment, serve as the primary keys to controlling the disease effectively. If you enjoyed this video, hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching.